Hello and welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we are joined by Dr. Aifric Boylan. She is a practicing GP. She completed her medical training at Trinity College Dublin, and she is the director of Qoctor, a startup which provides a range of online health services. Welcome to the show, Aifric.
Thank you.
Now, can you go ahead and tell us about yourself and what it is that you do?
Yes, so I'm a full-time GP working in a group practice in Melbourne. I've been in Australia for the last 2.5 years, and myself and the team of GPs I work with in the clinic, I suppose over the last few years have identified needs that our patients have as, I suppose, life goes online, and they're looking to find ways to solve health problems, without necessarily coming to the clinic for everything. And I guess we've looked at ways to try and solve that for them by providing the online option of getting, various health services through our website.
Now, so we'll be talking about the relaunching of what it was known before as Dr Sicknote, but now is called Qoctor. Well, what is Qoctor?
So I guess to go back to the Dr Sicknote concept was, I suppose, fairly one-dimensional. We were just offering medical certificates, and it was quite a simple idea, really, just to sort of keep people with minor illnesses out of the surgery, because they didn't really need to be in for physical examination, and most of those things could be solved through a Skype conversation. And we would obviously, if they needed examination, we would redirect them to their GP. With Qoctor, I suppose we realised there were other things we could offer online, and clearly the Dr Sicknote title was tying us into one thing. It was also probably a little bit cheeky as a name. So I guess Qoctor was just, it's obviously a quirky name as well, but it allows us to do more things, to offer more services that are less tied down to just the medical certificates. We can look at other horizons now.
And what was the thought process behind it, or like how did it come about?
Well, I suppose it was probably the brainchild of one of my colleagues, Dr. Sachin Patel, who just identified the need at the very start for the medical certificates. And as a practice of fairly young GPs, we were probably just becoming conscious of the fact that day to day we were seeing patients who had taken time out of their days. People like us, young, busy, all ages really, but a lot of people, commuting and very time pressed, and you just feel a bit guilty sometimes that they'd taken such an amount of time out of their day for something that, being honest, was, justified trip from their workplace or from their home, when really it just required a conversation and, some paperwork or whatever. So it's about being honest, I guess, and identifying a need our patients had. And it just became a conversation we were having. And, we realized, well, if you do medical certificates online, there are other things you can do online as well. I guess what we felt was that whilst there are, some similar kind of outfits already in the online space, we were very conscious of our vocational GP background, and our aim, I guess, was to try and see if we could find a way to bring those values and those vocational aspects online. We knew that it was something that would cause, I suppose, a little bit of discomfort for the traditional kind of model of being a GP, and that's fine, that's to be expected. But we felt just that looking around, well, you could see there were more and more outfits going online, and we felt that maybe having a service like ours that it was being driven by the GPs themselves was a good thing, that we could bring our vocational background and try and instill that into the work we were doing online, rather than it having a more corporate ethos, which I think will happen, inevitably with other brands and other websites that will pop up around the place. So the challenge was to bring our vocational training and try to provide quality and safety and something that people need. So that was, I suppose, the thinking behind it.
Mm-hmm. And what are some of the services your online patients can get from Qoctor?
At the moment, still medical certificates, care certificates. We are looking at launching an array of prescriptions online in the next few months. That's sort of work in progress. It's not ongoing as yet, but very much in the pipeline. We do an array of new referral letters for certain conditions that we feel don't require in-depth physical examination, that are kind of suitable for a more kind of history-based approach, that the information that we can get from a patient online is enough to pass over to a specialist. We do repeat referrals for people who've seen the specialist umpteen times before and just need to go back and need that piece of paperwork. If they don't need to go to their GP for another reason, this is one way they can do it quickly from their workplace or home. And again, we gather as much information as we can to make sure it's a robust referral letter. And we also do it, we will change, so if someone has a referral for a specialist and they decide that another specialist has a shorter wait time, we can do a change of specialist referral. The patient will still need their original referral letter, but we will append the letter we've done to redirect it to a different specialist in the same field. So that's sort of the current array of products. But like I say, we're looking actively towards the prescribing side of things now. And then consulting is obviously the next horizon as well, just in terms of giving not just simple online consults for medical certificates, but doing things like, maybe face-to-face consult or online consults for a whole wide variety of allied health and maybe even specialists, and then GP consults for more complicated issues that require maybe a longer appointment, or perhaps even diagnostics. So it's opening up a whole area. I mean, there's so much that can be done, and trying to tie that in with, other services that are out there, and kind of bring it all together online is our ultimate aim. But just baby steps at the moment. We're getting there.
Right. And where can people learn more about Qoctor?
Well, there's lots of information on our website about what we're doing, why we're doing it, and the various products there. So, if you just kind of browse through the website, I think it's pretty self-explanatory. And that's probably the best place to find out about it, I suppose. And there's a lot of, recently a lot of media articles about it as well, but I suppose the clearest information will be on our website. It's www.qoctor, that's QOCTOR.com.au.
All right, and what common misconception have you heard from the public about Qoctor?
There haven't been many misconceptions. I think most regular people just see it as a really useful way to solve a very common, simple problem they have in their lives. We do, obviously, inevitably, there are people who make comments maybe on our Facebook page or, elsewhere on forums or whatever online. Is this real? People don't really can this be true? There are actually doctors who work online, so that's one that people are surprised that it exists. There are people who think, these aren't, these GPs mustn't be, up to the mark, or they're somehow, that it's not genuine, or it's not as good as what you get in person. But I think once people actually use it, they realise we're just regular GPs. All of us work in regular clinics, so we bring ourselves, I suppose we hold ourselves to the same standards we would in clinic, if not even more so, because, you're online, you have to be extra careful, take very careful history, make sure you've safety netted thoroughly. So I think it's by using it people are reassured. I think, we know we've got, it's a cheeky name. It's kind of we try to communicate in a sort of a fairly straightforward way with the public. Because sometimes maybe that's not what people expect from doctors, but I think, the time has come to be, not up in our ivory towers, but more kind of, on the sort of the same kind of footing as the people who are using the service. And, but I think by and large, overwhelmingly, people accept it and think, well, what a great idea. This is so useful. And it solves problems that I have in my day-to-day life. I think that probably, if we're being honest, it is probably a bit challenging to other medics, and that's to be expected. It is a pretty different way of doing things. But all I say when people say that, it's like, well, we are a group of vocationally trained GPs. We are all very hardworking in our day-to-day practices. We're trying to do something different online for our patients, and the people who want to use the online service will use it, and those that prefer the sort of person-to-person contact with a GP can continue to do that, and that just gives people choice.
Now, before we go ahead and end our segment, what's a message you would like to leave for our audience today?
Well, I guess just, it's new, and it's maybe a little bit daunting to think of seeing a doctor online, but I think it's one of those things that people should try, especially if they're busy and are time pressed and find themselves taking a lot of time out of their day for minor things. we can certainly offer a helping hand there. So I think just try it, have a look at the website, have a browse around, and just give it a go really. And that'd be my main take home. It might not be for everybody, but it's certainly helpful service for a lot of people.
All right. Well, it's been a pleasure talking to you today, Aifric.
Thank you very much. Lovely talking to you too.
Thank you. Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Dr. Aifric Boylan as we talked about Qoctor, your quick online doctor. Now, if you've missed our conversation or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.